Well, yes, like everything, right?
Like everything.
People get lung cancer with less burden of smoking, right? And so for however much smoking causes lung cancer in white people, Black people who smoke less will get the same lung cancer sooner, right? And so
Mm.
the burden of lung cancer is worse on smoking Blacks. Now, the good news is that we tend to smoke less cigarettes. Overall, we smoke less than white people. We smoke later. We tend to start smoking later, and we smoke less. But the bad news is that less smoking still still causes a disproportionately high amount of lung cancer.
Huh.
So there's something about it. And so, the ultimate sort of analogy, not analogy, putting side by side is that, a lot of my patients smoke marijuana, right? There's no
Right.
increased risk for lung cancer in people who smoke marijuana. So if you think, it's just the smoke that causes lung cancer, just smoking smoke, right? It's not just smoke, because smoking marijuana doesn't give you an increased risk for lung cancer, but smoking tobacco does. And so that's an age-old question as to why. Now, smoking marijuana does give you chronic bronchitis, and it can give you a cough and all those things, but it just doesn't give you increased risk for lung cancer. And so people who smoke cigarettes or smoke marijuana wrapped in tobacco, blunts, African Americans tend to smoke more marijuana wrapped in tobacco. And so that gives you the increased tobacco, and it also causes you an increased problem with stopping smoking, because the tobacco is way more addicting than marijuana. So if you're used to kind of smoking it wrapped in tobacco, that's going to be a harder sort of thing to navigate, because historically marijuana is not as addicting as tobacco or alcohol or things of that nature. But we kind of got side
Interesting.
off. But just know that smoking tobacco is associated with a way increased risk of lung cancer, and the majority of the lung cancer burden we see is related to that smoking. So whenever you can stop smoking, that is going to help you to prevent lung cancer. Now, again, here in the States, we do lung cancer screenings for people who have 25 or 20 pack year histories. So if you smoke more than a pack a day for 20 years, you're at really increased risk for getting lung cancer. And so we would screen those people annually with a CAT scan, a CT scan, and see if there's anything there. And they've done great work with saving people, curing people. I saw a man yesterday who had prostate cancer and lung cancer, and he's been cancer free for like 6-7 years. So
Wait a minute. He had both at the same time?
he had, in close proximity, he had prostate cancer, and probably 18 months later they diagnosed lung cancer. Yeah, so I mean, he had them at the same time and survived both, and just stopped smoking 6 months ago. He smoked up until 6 months ago, so he survived both and started smoking again, which is amazing. I just saw him yesterday, and he said, I finally stopped smoking 6 months ago.
What got him to stop?
It's funny. He said he was smoking and he didn't like the taste, and he just finally said, I'm done with it. Finally, some resolution he came to. But whatever you can do to try to not smoke tobacco, that's what you would do to decrease. So if you decide you're going to wear a nicotine patch instead of smoking, nicotine patches aren't associated with increased risk for lung cancer. That nicotine may put you at increased risk for some other cancers, but not necessarily lung cancer.
Hi, I'm Dr. David Ajibade. Thank you so much for watching this video. If you would like to see more videos, please click on the subscribe button below. And if you want to be notified of when we upload other videos, please click on the bell button so that you can be notified. God bless. Take care. Bye.